Allison Rosen. Allison Rosen is your new best friend. Allison, with her good times never end. Allison Rosen, doing the wavy pencil dance again. Allison's your new best friend.
Hey everyone, hi, hello, it is me, Allison Rosen. Welcome to another episode of Allison Rosen is your new best friend. I'm very excited today. I'm sitting here with Dr. Drew Pinsky and Dr. Bruce
High sober.
How
How
do you
get this studio audience assembled every day? It's incredible.
I know. Yeah. Well, they've been lined up for hours and hours.
I saw that.
What's finally cold in California.
Yes. Weird.
Yeah. And there's always a few drunkards that we have to throw out, even though it's morning. But I just like having a live studio audience. I like the energy and vitality. See? Doesn't that just perk you right up?
Wow.
Yes. Very excited to have both of you here. Thank you for being here. Now, you guys Drew, you do 1,000 podcasts. But 1,000. But you have a new one together,
Bruce
which
and
is
I.
Weekly Infusion.
Yes, people like it.
I listened to the episode with Dr. Oren Tepper.
Yes.
Very fascinating.
The 3D printing guy.
Yeah, who just separated conjoined twins.
Yep.
So tell the listeners about this new podcast.
Bruce?
The podcast it is like a huge piece of marble. When it starts, we're now restructuring it. But it's Drew and I talking about, I think, current medical issues with, right now it's guest format.
See, Bruce is Michelangelo. That's the illusion.
No.
Bruce is Michelangelo bringing that slab of marble to life.
No, listen, doing this with Dr. Drew, it's like, let's say Drew is the Macbeth of literature and I'm the Cliff Notes. It's like...
No, we have a couple of producers. My wife helps out, and then Michelle Poe does our newsletter and comes up with the topics and guests. And she just lines up great people. And we talked to the guy from the Body Farm, the guy that plants dead people in the ground and then studies their decomposition.
I didn't even know about this guy.
This guy's amazing.
Unbelievable.
I had seen this on Discovery Channel years ago, and he's 85 now, but he was asked to determine the age of rustled cattle that had died. And this is like 40 years ago. And he was like, oh, no one knows how to do that. And so he thought,
started planting cattle. Then he started planting people. And what kind of maggots and what stage the maggots are in and what kind of putrefaction and all this, what state the bones are in. He can date, how long somebody's been dead and what kind of
Don't
situation.
You watch crime?
The
crime
listeners...
channel?
You don't watch murder porn? Allison, what's the matter? What kind of chick are you?
I mean, a little bit, but I want the listeners to know that you guys are lighting up when talking about different kinds of maggots and decomposition.
Well, just medical stuff we like. And so it's sort of medical things that Bruce and I like and share, but from a new and different kind of entertaining angle. Who else? We had
Nicole
and Jemmy.
Oh, my God.
Okay, so
Yeah.
I think one of you or Susan tweeted something, and then I clicked
Susan's my
around.
wife.
And
First Lady of Love.
yes,
Check that out.
That's right. So I checked Nicole's Instagram feed.
Did you vomit?
I wanted to. I couldn't stay on there very long. So it's like, oh, here's a necrotic leg, and then here's just some disgusting organ, and you have to tune in to find out what it is.
What's wrong with it? Not
Yes.
just what it is. What's wrong?
Right.
What's wrong
What
with
it is and what's wrong with it.
Yeah.
And she's what is she?
She's
a
a
pathology assistant,
Yeah.
which is
Okay.
a master's level position that I didn't know much about. But she's just a wealth of knowledge
Yeah.
about when you know a dead body, you know all the organs and the reasons medically that someone could die or what causes injuries. You know a lot of medicine.
And she's a character.
Yeah. I went back and I got a chance to. I had relatives and went to Philly, and she took us to the Mutter Museum.
Oh,
which, if you
yeah.
want to talk about bizarre medical specimens, and that's her element. She thrives in that. But she's just bright and a great personality.
Yeah.
Do you guys have? Does anything gross you out?
Yes, snot. I mean, no.
Sputum for me.
Sputum.
Sputum.
Yes.
It's the worst.
Sputum.
Sputum
Yeah.
being like someone hawking a loogie.
But when people with bad lung disease with heavy sputum, it's like nothing you've ever seen. It's like you're pulling it out in gigantic globs.
Oh my God,
Gigantic.
that's like a nightmare I have.
Yeah,
Where
well,
I actually have a nightmare
live
where
it.
I'm pulling stuff
Yeah,
out of my throat.
That's nice.
So that turns your stomach,
Yes,
Drew.
yes.
Sputum and it,
Gangrenous flesh.
The smell of gangrenous flesh is pretty bad.
Dude,
This
yeah,
is an awesome conversation. Even Nicole didn't drag us through this.
Well, I just wonder, because I think the average non-doctor person, their gross out meter is
way lower.
Yes.
Yeah.
And I think that you must have to work past that in medical school, right? You must be
It's
desensitized.
Bruce, I don't know if you have this. I have this very strange thing where things in the field, in other words, if I came upon an accident and it's out on the road,
Absolutely. I know what you're going to say.
Yeah, it grosses me out in a way that if you just roll that into a gurney, clean it up, and let me just look at things in a controlled environment, I have a totally different emotional reaction to it. It's very weird. And by the way, out in the field, I feel incompetent. Like I don't quite even know where to start.
I'm glad when the paramedics get there.
Yeah, me too. And in the emergency room or wherever, we know exactly what to do. It's weird. It's a weird thing.
And the other thing that gets me is when the families come in and the emotional component comes in, like a child dying, and then the family comes in. And,
my gosh.
And the longer you do emergency medicine, the
more that you're going to see.
You identify with more people in your life, elderly parents, you have babies, so that's real tough.
Drew, I know your story a bit more than I know yours, Bruce.
It's very boring, that's why.
Well, great, regale me.
I started out doing internal medicine and took boards, and Drew and I both have internal medicine background. Then I went into emergency medicine because I had bad ADHD and nobody noticed it in the ER. So we got this. I was out at Loma Linda, started an opportunity to be on faculty, starting an emergency medicine residency, and around 1985, 86, and at the same time noticed tons of methamphetamine abuse. When we did drug tests on trauma patients, looked in the literature, there's nothing. It was all, those are crosstops. I don't know what you're talking about, because I'd go to conferences, trauma conferences.
Crosstops?
They were the 60s pills that were amphetamine pills. So typically when somebody mentioned amphetamines, this is methamphetamine. So anyway, I went to a conference on, I thought it was toxicology and it was substance abuse at UCLA, and I started doing addiction medicine back then. So I still do addiction medicine in ER, though. I choose shifts.
And he did adolescent medicine, too. He's leaving one out.
Yeah, well, we both did. You were on faculty.
But you got the board. I never got the board in that.
Yeah, so anyway, so I'm still...
Wait, what happened with adolescent medicine?
We sort of did it for a while, then we didn't.
Right. I started
when
I started doing addiction medicine. The first thing I did was adolescent addiction medicine, and so there was a subspecialty of internal medicine that was available. So I took the exam.
And Bruce is the only person. Well, maybe one other guy, but Bruce is the only one that I felt had the training to fill in for me at Loveline. So I felt very comfortable. He's done it for 30 years.
Yeah, since 89.
Yeah,
so.
And so I could always leave that show in his hands, and I knew somebody who knew what he was talking about. Had the necessary training to deal with that show. The problem was he didn't have the training to deal with Mr. Carolla. That takes some special training.
I have pinata
kind of
training. I'm like a pinata, so I like to be abused. So that was so Drew was like, "Why do you want to come back there and do that?" I remember once I asked Drew about doing it with Adam, and he said, I can say to tell the story, right?
I think.
He
I don't remember.
Described it as 2 hours of someone's fingernail scratching on a chalkboard.
What? Come on. I only do 5 hours a week with him now on the Adam and Dr. Drew podcast.
I have no idea
some
what you're
ways.
talking about, because it's completely over my head, and I'm not relating at all. Well, do you find that to be the case, Bruce?
Oh, I get it. I get.
Well, they call him
beaten
Dr.
up.
Spaz over there.
I'm Dr. Spaz,
Yeah.
and there's a song about me that ends with "He'll stick a finger up your ass." So
I've heard this song.
Yes,
I like it.
yes.
I know, because I know you as Dr. Spaz or just Dr. Bruce, it was news to me that your last name is pronounced the way it is.
But he has a last name.
Well, I thought it was Heisbacher.
Yes.
But
Well,
it's
I
not.
did better with Hershiser. I really appreciated that comparison, but now that he's out of the limelight. But yeah, no, high sober, high shober. It means hay farm or hay barn. And yeah, so
Speaks
Elegant.
volumes. Elegant, yes.
yeah. But Drew is a trailblazer of, we'll complement each other here, but
Please.
I'm in awe of Drew's ability to do medicine in the spotlight. If I were doing what he's doing, I would have lost my license 30 years ago. So it's very difficult. I mean,
It is tough. I know
And
that.
the interesting thing, an example of what happened at Loveline that just fascinated me as an adolescent medicine physician was somebody called in and they were asking about, it was like, dude, I'm smoking, my bong's aluminum. I was wondering if I could get brain damage from that. And Drew didn't say anything, and Adam said something about, he just said perfect timing, implying that it's not the aluminum you got to worry about, buddy. It's the pot. And then I had a colleague approach me who had heard the show and said, that show is horrible. They were making fun of this poor kid that was obviously intoxicated. And I said, I told him, which I have no filter, I said, you're a moron. And I said, what you're missing And I quoted, there was a study that showed the only thing that can combat alcohol and tobacco advertising is humor. And it's like every kid out there listening to that got the message loud and clear.
Right.
Whereas the doctors, which is typical, well, this was, and in this age of increased this was a long time ago, but even now it's like the political
us in a white coat speaking formally about the natures and dangers. Now, who does that reach?
Right.
No one wants to listen to it, and especially not the kids we want to be talking to.
Why is the medical community so fusty?
Fusty.
Well, because
nice word.
I think you look at the English tradition.
Pomona College, Bruce. Pomona College.
Oh my God!
I majored in the word fusty.
He's from out in the Claremont area.
I'm totally intimidated.
It was years ago. I've forgotten all of it.
Do you know Bob Forrest
lives in Claremont, right?
Yes.
Yes.
How crazy is that?
I know. It's such a. We used to call it Clareville.
But it's becoming like a place.
I know there's a comedy club there.
Yeah.
Now. They serve alcohol.
But the best place, is the Folk Music Center.
Yes.
But do you know his girlfriend's parents' restaurant there? It's some famous restaurant that they have run forever.
Which one?
This came up when I did This Life with you guys.
Yeah,
and Dr. Bruce was there. It starts with a D. Like, I've been there. Yeah, I know the restaurant. I'm blanking.
I'm sure I've been there. My kids love going to Claremont. They got a great record store.
Well, Bob's there all the time now. So
it's the closest thing to Ivy League.
Oh no, Pomona, I think got ranked #1 this year, didn't they?
Oh, did it?
Yeah.
It's always ranked. It is ranked very high, and no one's ever heard of it, and people assume it's a JC, and then
or it's at Cal Poly.
Yeah.
Pomona College is you go east of Denver, and people genuflect when you say Pomona College.
Oh,
I better go there.
Drucker was there, and all these famous professors. But
thank you.
I went to Loma Linda School of Medicine, and I did an elective back at NYU. This was a great story. So it was an internal medicine, and they pride themselves, at this time years ago, they said, we've never accepted anyone west of the Mississippi into our internal medicine residency. So we were going around, I was a renal fellowship, and the first guy, the attending's asking us where you're from. Brown. Oh, say hi to Dr. Schwartzman there. And then the next guy's from Cleveland Clinic. Oh, say hi to Dr. Jordan. And then he came to me, I said, Loma Linda. He goes, oh, where in Mexico is that?
Well, so the question, to put it in other terms, why is the medical community out of touch? Are they out of touch, and if so, why?
Well, let's think about it this way. If someone's going to medical school, they start focusing on that when they're about 14, typically. Not exactly super socially engaged, generally speaking. I don't even know what happened in the world from about 1982 to 1990 because I was in my training so deeply that I just was not, and you're around only in a military system. It's a militaristic system where you don't step out of line, and there's a pecking order, and only the people in the highest level of authority get to speak on behalf of other people, and those people are not. I remember I had a website for a while, and I had a medical director on my website. We sent him out to the NIH, and he met with some of the leaders there, and we were trying to figure out how to get them an online presence. And it was when I was on MTV with Loveline, and the guy said, Dre's on Loveline. He's the show Loveline. They're all like, huh, what? And he goes, it's on MTV, and he noticed
nothing.
He said, MTV, you know, no, they'd never heard of MTV. So they're in their ivory towers, they're in their laboratories, they're in the hospitals, they're focused on things that they think are vitally important, and it's not communication.
Right.
And it's not entertainment or how to reach people or how to change behavior. Psychologists get a little focus on that, but it doesn't trickle over to the physicians.
Right.
But adolescent medicine is an interesting area, and there are training programs now. Richard McKenzie, whom we both met early on, was instrumental in pioneering that. Just remembering when you and Adam did Loveline from the American Society of Adolescent Medicine.
I remember that.
Their national meeting in Los Angeles. And
I do remember this.
It was amazing. Yeah. It was amazing. And adolescent medicine, I think those docs they're really in touch with what's going on. They're, family is the unit of treatment, and they deal with what are the current issues with adolescents.
They diagnose over Snapchat.
Well, social media is,
But I don't see many of those people around anymore. Again, I see more psychology and social worker picking that up.
Yeah.
Not so many physicians.
But it seems like you guys both, if I'm reading the energy at the table correctly, kind of pulled away from doing adolescent medicine. Is that right?
Yeah.
I definitely myself. There was less funding for programs, and in substance abuse in the 90s, I think a lot of the funding just dropped away, and programs that were
All the
funded-
psychiatric facilities dried up. You couldn't even treat them in a facility. And there was only locked facilities. It got kind of gruesome. It wasn't sort of healthy kids. It was really problematic kids.
right.
Were some of the complications, I mean, did it have to do with malpractice and being litigious stuff?
No, I don't remember that.
Because I think it's harder to create a billable diagnosis for a lot of what goes on with teenagers, and prevention
Right.
doesn't get the funding that it should. And there's something called public health emergency medicine, which I was real excited about, but it's something that physicians, I think, are overwhelmed with treating.
Sick people.
Right.
We're too busy with sick people to worry about nutrition. I was
Right.
telling somebody was talking about, I don't know, the doctor's nutrition and stuff. I said, look, when I needed my prostate out, I didn't want my goddamn physician worrying about my diet. I wanted him to not have any complications with that fucking procedure. And he'd done 1,200, had a 0% complication rate. I just want him doing that procedure all day. I do not want him thinking about anything else.
Yeah.
That's important.
Yeah.
And you don't get paid for a lot of the internal medicine. The argument is doctors that don't have procedures that they normally do that they could bill for, which gets a lot more money. You don't get paid for the time you spend with the patient.
Right.
And
Or the complexity of decision making. I spent an hour on the phone with a patient yesterday. Super complicated, med psych, all kinds of complicated things. And I was able to distill it down and make 3 recommendations. It took me an hour. And I thought, I can't charge 1 penny for that.
right.
Not 1 cent.
And they're frustrated patients. I just got an email, one of your listeners or our listeners with common immune deficiency disorder, something that's very complex. And the way I understand, somebody that just starts out having a lot of weird infections, sinus, throat, and it is hard to diagnose. And they don't have HIV. They're mistaken for having HIV. I don't know if you responded or I should respond, but it's
Let's
very
do-
frustrating.
Let's do an episode on that.
Yeah, we should.
It's a good one.
I didn't even know of this disease.
I didn't until I read that.
It's
tell you
sort
the
of
truth.
poorly. I would say I'm not sure it's well accepted.
Well, unless
People just assume
We
that
should get an
it's HIV.
allergist, immunologist on and talk
should.
about it. Yeah.
I think 25% of the time, I think you can measure immunoglobulin levels and they're identified. And
25% of the time.
right. The other time,
Now you're into the area
right.
if it's not measurable.
So, Bruce, you said that if you did what Dr. Drew did, which is treat people in the public eye, you would have lost your license.
Well, yeah.
Correct?
It was sooner than he actually did listen. Sooner
Right,
than it
would
actually
have
happened.
hastened
How
the
dare you.
process. So, Drew, what are the challenges of being a doctor in the public eye?
You have to walk the razor's edge all the time.
Explain.
Meaning that I have to accept the fact that I'm not entertaining, and that in order to capture eyes and ears, I must piggyback in with people that do know how to do that and be trusting of them and willing to let them do their job and find ways to insert myself to deliver things that I think are important without disrupting what they're doing. And that's hard. And not seeming irresponsible or seeming inappropriate or diminishing the message or somehow having the message adulterated in some way.
Can we
Right.
bring up the Hillary Clinton thing?
Sure.
So,
talk about that now.
yeah. So I was watching what was going on.
We did a whole episode on that.
We did a whole
so,
episode,
yeah.
but I talked to you on the phone the day that whole thing blew up,
Yeah.
and I don't want to say too much, but it's saying something about someone's health, commenting, and you can't say something about an individual if it's your patient and say who they are. But in the case, the media has a they put you under the microscope, look at everything you say, and it's twisted and
distorted,
turned and
yeah.
distorted,
Always
and
distorted.
in a climate with a political.
Right.
Well, you could verbalize
All right,
better.
so
I'm
what happened
getting
was
into my spastic.
I did on one day I did 10 minutes with Don Lemons on what we thought was going on with Donald Trump's mental health, and I was talking about hypomania and businessmen and stuff like that, and nobody noticed it. No big deal. Next day, my radio station got me and they said, "Hey, that was interesting. Do that. Give me 25 seconds. I'll put it on our website." Same thing. Did 25 seconds.
On Trump. And this
On
was leading
Trump.
up to the election.
Yeah, this is like 4 months ago, maybe.
Okay.
And then he goes, "You have anything to say about Hillary?" I go, "Yeah, I think her doctors are screwing up." He goes, "Give me 25 seconds on that." And I analyzed what her doctors were doing,
And
not
what was-
her health, what
Right.
her doctors were doing.
What was
And
that based on?
the record the
website.
doctor sent out. Her doctor sent out
On
a
her
record saying,
website.
"Here's what we're doing." And I was like, "Oh my God, you got some. This is not good."
Right.
And they're giving her an old-fashioned form of thyroid for not even a diagnosis of hypothyroidism that causes clotting disorders. She has a clotting disorder, and they're treating it with means that are questionable. And so I was just taking issue with that. Now, since then, they've answered all my questions almost like they were interrogatories and got consultants and changed their treatment a little bit. So good for them. But the Drudge Report picked up on that, and it became this thing that this doctor says Dr. Hillary's sick and going to die.
In Huffington Post.
It was back and forth.
It became an ad hominem attack on Drew's.
Yeah, how dare I? How
which-
unethical to speak about.
Right.
It was her record. I was just driving, and I wasn't talking about her. I was talking about her doctors.
Right.
It was the most bizarre thing I've ever been through. And then we planned to stop my HLN show, so we stopped it about a month later. We determined that 2 months before. Now it looked like I'd had my job firing because of what I'd said, and so then I became a hero. Oh, they're silencing him. None of it's true.
Right.
But once the narrative gets going, you cannot change it.
Yeah.
People don't want to hear it.
Did you try to change it at all?
Well, I was asked to sort of shut up.
By
CNN.
Okay.
I was asked to sort of stay out of it.
Was
like,
your
all right.
instinct though to
I would go
try to
get ahead of it. Yeah.
Yeah.
Especially when they started taking on CNN. I said, look, guys, I'll get up there and say this isn't true because it's not true.
Oh, right, because people were wagging. You just said this. People were wagging their fingers, saying, "Look at CNN shutting him up because he said something anti-Hillary."
Yeah,
right?
they're
That's what
firing him. He lost
Yeah.
his job because of it. And I was like, no, I had nothing to do with it. And well, they said, just shut up. So okay.
But now you're still doing a lot of stuff for CNN,
Yes.
right?
Mhm.
Yeah. That must have been very frustrating. That whole thing.
The helplessness associated with social media is extremely painful because as one of the problems of being physicians in the media, in social media, you can't respond.
Mm-hmm.
You cannot defend yourself because you could hurt somebody, and you can do no harm as a
Right.
physician. So I just heard recently though that when they call you a quack, you can go sue people. So I'm thinking that word apparently has a liability attached to it. Really? So I could be a multi-millionaire soon because people do that shit all the time on social media.
It is interesting the way you are hemmed in because Adam can say whatever
he wants.
to someone on Twitter.
Absolutely.
A comedian can tell someone to fuck off.
I can't do anything.
Right. Because of your Hippocratic Oath or
I had my license. I can't hurt somebody online. I can't respond. If I respond, I'm gonna have to keep responding and go to the mat with it. I can't get into that.
Right.
And by the way, they may be mentally ill or something. That may be why they're saying these horrible things. I can't do that.
So how do you blow off steam?
Work out, run.
Who, me?
Well, now I'm looking at you. I'm wondering, do you feel hemmed in the same way?
No. I listen. I mean, it's really an honor to work with Drew and do this podcast that we're doing, Weekly Infusion, and it's a fascinating window for me. I think very few people have the luxury of seeing what goes on in media with medicine and the reality. You watch Dr. Oz or you listen to Dr. Drew, but it is, I think, one of the most difficult things a physician can do, and the criticism from all quarters, and with social media being the way it is. You immediately have their blogs and websites that analyze everything you say, and that's why it's so difficult. And it's difficult. What I like about Drew, it's like if you ask me to explain borderline personality disorder, I will become spastic. It's very difficult.
He becomes Dr. Spaz. He goes from Bruce to Spaz.
Right. I know it when I see it, but sometimes explaining something. And in medicine, a lot of it is, I think there's still an art. And if I'm working with a patient, you have a gestalt for a diagnosis. But if you ask me in 15 or 30 seconds to explain that, and if you have somebody like Adam Carolla, just with that ass-eating grin on his face, waiting for you to, and then so it's very difficult to do and to succinctly describe something that's very complex in few words with a cadre of critics out there. It's very difficult.
Well, it's interesting. It sounds like what you're saying is under the pressure, like when you're on mic and there's pressure on you, it inhibits your ability to articulate something.
For me, yeah.
However, I imagine that the ER is a very high pressure situation, right?
But by taking action, it sort of bypasses that cognitive pathway that you take in explaining something. You act, and that relieves a lot of the tension that's there. It's like I had a professor that would tell us in internal medicine, just do something. And why I found the ER is you have to do something, and that really sort of relieves. Sometimes in internal medicine, it's like there are jokes. I don't know how it goes. Pathologists do everything but a day late. Surgeons do everything too soon. Internists do everything, and nothing happens for a year. And it doesn't make a difference anyway.
So I have a question that I don't want it to sound like vaguely accusatory, but it might anyway.
For me or Drew?
For both of you.
Oh.
So my dad's a doctor, retired, but I remember growing up, he really lamented, quote unquote, medicine as entertainment. Like, he would never watch an episode of Grey's Anatomy, and he hates that. He hates that it's become entertainment.
I didn't know this. Now, why would he hate that? He's a psychiatrist, right?
No, he's a GP.
GP, okay.
Yeah.
Why did I think he was a psychiatrist?
I don't. My grandfather was a psychiatrist.
Oh, maybe that's it. Yeah. Why would he not like that? I would think he does he lament all the legal shows that are? We have attorneys everywhere.
Right.
Their ethics, their standards are stamped all over our culture.
Mm-hmm.
Shouldn't physicians and
No, but
medicine
I think when I watch Marcus Welby, I think that was his era. I think it just creates an unrealistic picture of what a doctor does and what you should expect out of your doctor. And there's always it's like a story. It's brought to a conclusion, and it's always
Right.
was it that part?
I wish I knew exactly what it was. I think it's the idea that it might be a sort of like, as doctors, this is science. We're saving lives. It's important.
He thought it diminished it somehow.
I think so. And it shouldn't be something that's consumed as entertainment, because that could muddy the waters.
Right. He came from an era where they were, deliberating from on high.
Yes.
That is over, and it's not because the entertainment thing.
No.
It's being undermined on every front. The
Right.
entertainment thing at least makes it more approachable.
Right. So your defense of so you feel like
I feel like it's how you that's the only way you can distribute information medically these days is
Right.
by making it entertaining.
I think there are a couple of things. I think like that book House of God, when probably we were in medical school or college or training, it was very irreverent. And some of those descriptions of what day-to-day life was in training were very irreverent and probably a negative light in some words. For me, I think the Vietnam War created emergency medicine and addiction medicine in a way. And I think a lot of things changed in terms of opening things up, what you talked about, how you approach the patient. Because really, with addiction medicine, I mean, people coming back that used heroin every day, some had a problem, some didn't. People realized there's a medical disorder here.
How did you guys meet?
That's a good question. I don't remember.
Mike Finnegan and Candy Finnegan.
Really?
Yeah. So I knew I was asked to do talks on substance abuse with a character actor, John Dennis Johnston, in the Inland Empire here. And he's sober, and his sponsor was Mike Finnegan in AA, and this is the mid to late 80s. And so I met his sponsor, and Mike Finnegan he's a Hammond organ player, and his wife now does A&E Intervention, who was a guest on our show.
Candace, yeah.
Mm-hmm.
So I met him in the late 80s, and they had talked to Jed the Fish. And you guys, I guess they were doing this Clean and Crazy thing every 2 months, and it gave you a Sunday night off every 2 months.
Oh, yeah.
And so Clean and Crazy was an attempt to use the Love Line, which was on every Sunday night, to just talk about recovery. And so they said, hey, Jed's looking for a doc. They met him. They're talking at an AA meeting. So I get this call, and I wasn't hugely into K-Rock at the time. And it's this guy, hi, it was on my recording machine. Hi, this is Jed the Fish. Anyway, and then I was hanging out there, and you came in for some reason, and we just started talking.
Wow. Well, that's a long time ago.
It's a long time ago.
Wait,
by the way, I want to talk about the entertainment thing real quick.
Okay.
Which is that I wonder if we could convince him by showing some of the data that's out there on things like Teen Mom, like where you show very clearly that the magnitude of viewership in a community is inversely proportional to teen pregnancy rate. That is, the more people watch it, the less teen pregnancy.
Right.
It has a scientific impact when you deliver message through an entertainment vehicle.
Mm-hmm. Well,
like a behavioral impact.
How do you, Drew, feel about a show like Grey's Anatomy? Have you seen it?
They make me insane.
Okay, well, so that's
insane.
kind of the same as my dad. But why does it make you insane?
Because it's so inaccurate and so pathetic, and so particularly the behavior of the doctors is so intolerable. I mean, you listen. Two things. One episode I watched. The first thing that happens is the intern responsible for resuscitation vomits. I'm like, you're fired. You're fired. Get the F out of here. I don't want you under me.
Yeah.
If I were the senior resident, you're fired. Number one. Number two. Then one of this physicians gets in bed with a patient. Okay. You're fired, and you're going to jail. You're going to prison for that behavior. Not only are you fired, you're going to prison, and none of that is addressed. And so I'm like, okay, well, I'm out. This show's terrible.
I get anxiety. I ask myself, what should I do or what would I do in this situation? It's like I don't want to be in a situation where I'm back at work. And so there's that aspect. And I think it is. Now, Drew, what about the reality shows like Sex Brought Me to the ER?
I think some of that stuff is interesting. Well, that's a recreation sort of show, right?
Yeah, I don't know. I haven't
But
seen
I
it.
think reality shows can have a real impact. I think people want real. They want it real. That's how they want to consume it. They want to see what's going on. As long as it's explicated, as long as there's a way to understand what's going on, not just oh my God, but use it educationally. I'm all for it.
Right.
All right. I need to take a moment to talk about Beachbody On Demand. Drew mentioned that what he does to blow off steam, instead of going off on people on Twitter, he works out. Are you guys familiar with Beachbody On Demand?
No, tell me.
Beachbody is the company that does like P90X and Insanity and
Wow.
tons of workout programs. In the past, you had to buy.
We need them on our podcast. Come on
That's
now.
right. Come on, Beachbody. In the past, you had to buy all the discs, but now it's streaming on your device. So you can watch it on your tablet or on
disc?
your
What is
television.
that? What's a disc?
That's in the old.
I got
old
a
days.
disc with it. I bought a printer last night. It came with a disc, and I was like, what do you do with it? They're still selling discs.
That's yesterday's technology.
insane.
Beachbody On Demand is in the now and in the future. It's amazing. You can work out from the comfort of your own home, or especially if you're a traveler, it's great because you can keep up with your workout wherever you are. And you can get a free 30-day trial. And some of the programs like 21 Day Fix Extreme, let's say you have a big event coming up and you're like, I need to get into shape, for something that's coming up very, very soon. 21 Day Fix Extreme. You can do the whole program on your 30-day free trial. I don't think they would want me to tell you that, but I'm just saying, you guys, you can do it. T25, 3-week yoga retreat. And they also have a brand new first of its kind cooking show for healthy weight loss and portion control called Fixate. They also have a special program for maternity or for pregnant ladies, which I thought because I had worked out with a trainer in the past, this will be super easy. I was winded like before I started pretty much. They have a different one for each trimester. So Beachbody On Demand gives you the ability to stream hundreds of workouts from programs all proven to deliver amazing results created by world-class super trainers. This is a brand new service, but it already has 1 million members, almost 1 million members. And my listeners can get a free 30-day membership. These would be Allison Rosen is your new best friend listeners. Just text Allison, ALISON, to 303030 and get a full 30 days of access to this entire platform for free. So again, text Allison, ALISON, to 303030 or 303030 and get a full 30 days of access to this entire platform for free. Okay.
So this brings up, and we're separate from the commercial now, but biohacking. I had a patient come in and say, what do you know about biohacking?
That's just a word of the day.
What does that mean?
Nothing.
Well, yeah, but
It means it means
fad.
changing your metabolism or optimizing your metabolism.
I think people are making a lot of money on it. So, yeah, it's people that say, I'm going to live to 200 years old.
It's the next thing since toxins.
Well, I remember reading articles saying severely restricting your calories and being underweight is like the one thing you can do to live longer.
That data's been around for 40 years, I'd say.
Is it true?
It was on rodents, by the way. I don't know that it's been reproduced in mammals. I suppose it has. And no one can do it. You have to be 800 calories a day or less for years. And yes, it probably extends your life, but I couldn't say that.
There are also
it's never
studies-
been done in human, that's for sure.
Poor hungry rats.
Well, I think there are studies that show that people that are slightly obese.
Not slightly obese. There's the fat. What do they call it? The fat.
Super
There's a
obese.
name for it. The fat paradigm or fat problem, which is that people that are overweight live longer.
Right.
And it's a dirty little secret that no one wants to talk about. Yes, they have more hypertension. Yes, they have more diabetes. But if they don't have those complications, or if they're properly treated, they tend to live longer.
Right.
What?
Yes, I know. That's people don't talk about that. Now, I think probably the reality is that within, and we're not talking about morbidly obese. We're talking about in the BMI spectrum obese, right?
Right.
BMI standards.
sure.
Like how many extra pounds would you say?
10 to
It's
30.
hard to say. Because that data's not out there.
But they look. Some people that we would
They
say
look 40, 50 pounds
Right,
overweight,
right.
easy in the stuff that's I've seen. I'm going to bet there's subcategories within the population.
Right.
Some that live longer at that weight, and some that don't live longer at that rate.
And somebody would say it's an evolutionary. People that were in
What
areas with
evolution,
no-
Bruce? You can talk about evolution. Have you evolved yourself since we've last spoken?
Wow.
Of this?
Wow.
Wait,
Go
were
ahead.
you-
That was
were
an
you-
attack. That was an attack. Just so
I
you
need
know.
to
An
find
ad
out
hominem
about this attack after you say what you're
Well,
going
he
to say.
doesn't remember any of these things. But I was talking with him. Who's the guy from Bad Religion? The professor guy.
Greg.
Greg,
Yeah.
And Adam and he and Greg. And they were talking about something. And I mentioned intelligent design or something like that. And
Yes.
within 1 second, it was just like 3 sets of piercing eyes focused on me. And then the other guy, Greg, whatever his
Yeah.
name is, he goes, science and religion are incompatible. And then the conversation just went on as if nothing had happened. And I was like, F you, Drew and Professor and Adam, of course.
Well, all right, evolved. Maybe they evolved. At least you gave me that. So
No, I'm Christian. I'm
maybe
not
the mechanism
I'm
has
not
evolved. Finish your thought, though.
Which thought?
About the obesity. About the obesity.
So I think there is natural selection for certain things. And I think in times of
Scarcity,
famine
yeah.
or whatever, there may have been a genetic choosing for it, just like the dark. Like,
So that may be, in other words, people that are obese may even live even longer if they were lean,
thank you.
right?
Right.
Because it's just already a genetic, the fact that they retain and distribute and retain energy so efficiently, that's already an evolutionary advantage.
Right. But with the internet, someone's going to listen to this podcast and within 48 hours, there'll be a get fat and live longer
Yeah,
plan
I
being
know.
sold
I know.
somewhere.
People attacked me last time I brought this up. Attacked? How dare you talk about that? It's the number one health problem in our country. It's like, yeah, I'm not saying obesity is good. I'm saying there's this weird idiosyncratic thing that's out there.
Right.
Right.
Do you feel like any part of the people attacking you was fat phobia?
Fat.
Well, let me
phobia.
rephrase. Do you
I would
feel
say
like
more, yeah, no, I'm more like anti-fat phobic was what I was getting.
Well, but people that are afraid of people that were just overreacting to people that are obese, and then he's saying maybe it's okay, and so now they're flipping out.
Yeah.
right? That's
How
what I'm.
can you as a doc?
That's what I'm saying. Meaning, people who are less. It was less about health mindedness than it was about people being upset with
Here's
the
my
notion that
problem.
maybe being fat's okay.
That's right.
Yeah.
Well, no, the notion that, listen, it all ultimately boils down to people don't understand science. They're not being trained, they're not being educated, particularly in biology. And they have to understand biology is infinitely complex. The best we can do is describe probabilities, and we're just looking at an anomalous, interesting phenomenon
Right.
in a biological system. You have to be completely open-minded and understand we are primitive in our understanding of these infinitely complex things. So when people make these sweeping statements about diet and how things are digested, I just think it's too. It's so complicated. We have trouble describing how one molecule gets from your mouth to where it ends up in your body.
Mm-hmm.
Forget entire, food products. We can't label a molecule and figure out how it gets from A to B.
Right.
Sounds like the good thing about your exercise program. I'm having a lot of people, especially people in recovery, that are looking for something quicker to get back to good health. They want testosterone. They want human growth hormone. I don't know if you're, or just having people asking, well, there's so much testosterone being taken, and it's a younger and younger age. I could see somebody that's in their 60s or 70s. And I was talking to an endocrinologist, said, well, if they want to increase it 20 or 30%.
What? The levels,
Testosterone,
yeah.
right.
Yeah.
Measure levels carefully. And I just read some stuff about the lack of evidence for it accelerating prostate cancer, because that's
I
one
know.
of the big concerns.
No, I know.
And-
But if you have prostate cancer,
Oh.
they don't know. And that's why I want testosterone, but I'm afraid to do it.
well, this one said if you do, it doesn't create a more aggressive form.
That's true,
Doesn't
but it might.
exacerbate it.
We really don't know.
No,
See, one of the
right.
features of prostate cancer is we don't know what activates the bone metastases. They seem to sit around for a long time and then they activate.
Right. Interesting.
And so the activation process may have something to do with androgens, because we decrease the production of mets with androgen blockade, right?
Right.
And so that's where the anxiety comes in for me, particularly.
Right.
So, but I want to take testosterone. I'm sold.
Why do you want to take
Because
it?
I'm sold it's a good thing.
Oh,
I'm
yeah,
a hormone
absolutely.
replacement guy. I think it's a smart thing. I think it's a good thing for us as humans.
And it,
Bruce, are you juicing?
yeah, I'm juicing with water, with orange juice. No, I'm not
Lime.
juicing. I don't know. Do you know of any trend diets that you swear, like ketogenic? That keeps coming up, or
Those are
Any-
good. I mean,
it's taking it to an extreme. I
Yeah.
would assume because people ask, especially in working in addiction, and in the ER they don't usually ask. It's a different story. But in recovery, and somebody's recovering from substance abuse, there's a lot of sudden interest in how can I reverse what damage I've done, or how can I.
describe what your. I just say do your spiritual work when they get into that crap, especially when they're not less than 5 years sober. It's like, stop it. Just focus.
I go
on
back
your
to the
work.
12 steps
Yes,
and everything
still
doesn't
focus
happen
on
in
your
a
work.
day.
No.
and
That's somebody who's got we say
They're looking for a new
in the
religion.
community say there's a problem with the spirit when people behave like that.
Right.
But your girlfriend describes some really interesting stuff about how the change in the healthcare system has affected ER functioning. That was a really interesting conversation.
I probably wasn't listening to what you said.
Well, about the demand, how demanding people are, and how they demand to see the administrators and the chief of surgery.
Oh,
It's weird, and they bring gigantic groups of people in and make these demands, and the hospital isn't even reimbursed for the care.
Right.
We're in Fontana, so I shouldn't mention that. So the Inland Empire, I don't think it matters where you are in the United States now, and I think it's a product. Some of these TV shows where people have interests in or have.
They come in thinking they know something, right?
Right, and demanding MRIs and demanding CT scans. And then the other side of it for physicians that are practicing now is the patient satisfaction surveys, which is becoming
This
a
is
huge
the worst
business.
thing ever. Do you know what this is?
I think I've heard you
This
mention
is like
it before,
if
Bruce.
an opiate addict comes in the ER and goes, I need my fentanyl patches refilled, and you go, you're a drug addict, we got you treated. You're an asshole. I'm going to give you a 0 on your physician evaluation. That doctor will lose his or her job.
It's a 1 to 10 scale, and so
so
they call it a
backwards.
Unabomber. The Unabomber gives you all ones, and if you don't see
Yeah.
a lot of patients,
So who collects these surveys and where
Administration.
Press Ganey, isn't that the company there's one company that started out on this, and now it's a huge stock exchange
The
juggernaut.
same
It's-
version of this was the smiley face scale for pain.
Oh, I've
Yeah.
seen that so many times.
That was a disaster for us.
Why?
Because there was in a time what caused the opiate epidemic. The drug companies were very happy with it, but they did not cause it. What caused it was the attorneys and the pain treatment standards that were instituted through the administrative organizations, departments of mental health, the JCO, this sort of thing, where if you didn't treat pain adequately, you were not just committing malpractice, you were legally, criminally, potentially in trouble.
That's so interesting. So I had no
My
idea.
patients were all the very frowny faces.
Right.
Because they're going through drug withdrawal. They're in pain.
Right.
That's the syndrome of drug withdrawal. And we would get dinged all the time for that.
That's so interesting. So those charts that you see hanging on every hospital wall, that doctors did not come up with those.
No.
with the faces.
Yeah.
Well, now we're using them. You can use them for kids and stuff like that. But I mean, the way it used to be in the 90s, it was like
Terrible.
make the person happy and say they're pain free, and for the wrong person. It just created a whole community of addiction.
Do you think there's a lack of tolerance for pain? Because that's another thing I've heard my dad say is, you might disagree with this, but he'll say pain is not a medical condition.
Neither is misery. And so that's the thing. I would put it under misery more than pain, is that ordinary misery is something we all seem to be intolerant of and want to be able to medicate away. Much like you, I was raised by a primary care doctor father, and he was like, don't take medicine. Medicines are when you're sick, when you have to take it. I never took an antibiotic my entire life. I remember one time I did when I was like about 15, and it was like, this is an event. This is like, you're going to take an antibiotic, and listen, this is serious business.
Right.
And I think we've just completely lost track of that. And somehow pills and everything, any kind of sort of therapeutic intervention is supposed to take away ordinary misery. And that's a problem. And I think the reason we're so intolerant is our childhoods are sort of impoverished.
I have never taken antidepressants. But I was very afraid of them for years. That being said, a lot of people I know are on them, and they're helped a lot by them. There is something appealing about the idea, though, of, maybe I don't have to feel these bad feelings.
Yeah, I get it. Listen, I had horrible depression, anxiety in college, and I was mistreated, and I'm pissed. They should have put me on a tricyclic antidepressant. That's all we had back then.
Right.
And they didn't, and I'm furious because I was in misery for a couple of years. Didn't need to do that.
Right.
But it also taught me some grit and how to overcome things and how to just make change that helped me overcome stuff that was miserable. That was worthwhile.
Bruce, what was your character building experience?
Being me.
What does that mean?
Oh, I don't know. My character building experience. I look back and I'm pretty ADHD. I have a very difficult time focusing, and I was diagnosed with that. I was put on Adderall. I experienced just interesting whole other story. I'm not going to tell because I'm going to write a book about it. But looking back, I just had a very difficult time. If I could focus on something, I would excel. If I couldn't, if it was boring or uninteresting, I couldn't. And the whole story with ADHD, and just talking about I think there's a vast amount of over medication with Adderall, just running like water in a stream through college campuses. And so, but I think certain things like that, I think in psychiatry, doing addiction medicine, you interact with psychiatrists. I'm not a psychiatrist, but you see there's typically the pendulum swings too far in one direction and then it goes too far in the other. Right? It's just like dealing with a kid yesterday has coming off methamphetamine, shooting LSD IV, crazy stuff. Have you had any of those?
No.
The guy was mixing it with water.
didn't even
like
know
Was
you could
how
do
was
that.
his brain?
Oh, this kid's brain is 25 and he knows pharmacology. I'll mention a drug.
Yeah.
Not even an abusable drug.
Yeah.
On Dancetron. Zofran, that's
Yeah.
Anyway, so methamphetamine, opiates, and
Was he
hallucinogens.
injured by
He
it?
was, yes. He was having voices. He was hearing voices. The voices, though, he'd say, well, they're not telling me to do anything, but they're highly critical. And so the bottom line is he tried sobriety, tried naltrexone. I have him on Suboxone now, which
Okay, but go ahead.
Is Drew anti-Suboxone?
I'm not anti-Suboxone. I'm anti-excessive enthusiasm about it, Suboxone. I think it should be like everything.
I said we
in
tried
its place.
naltrexone first.
Well, and listen, for this kid, this may be okay.
Oh my God!
Yeah,
So
I get
he-
it.
I got him. He came in. He was a dealer, and he'd been in treatment in psychiatry at age 17 for mood disorder, etc. And anyway, so now he comes in and he chose to go into treatment. Was inpatient.
Sounds bipolar.
Started on Zyprexa.
Is he bipolar?
No, the psychiatrist started him on an SSRI yesterday because he's having extreme anxiety and started smoking some pot. He's been sober a couple months. Started smoking some pot and
What? You mean Suboxone didn't cure his addiction?
he's
What?
craving. No craving. He's not craving.
Craving is
He's going to meetings.
Hey, Bruce. I've got something I got to say here. Craving is a good thing. Craving is a good thing. This idea we have to treat craving is catastrophe. I always told my patients my entire career, you're having cravings? I'm sorry. But guess what? It lets you know your disease is alive and well, and you need to do your treatment every day. The people that have it all together, I'm fine, I have no problems, those guys relapse. The craving guys show up in the meetings. Cravings are good. Cravings are good.
That's interesting.
We'll see. I can't. It's like I'm bringing a knife to a gunfight with her. It's just I can't do it. So with this kid, the interesting thing is, my approach was that he did need. He started taking some Xanax, and I met with the psychiatrist before his appointment yesterday, and we talked, and we put him on low-dose Klonopin instead. Well, he was taking Xanax.
And Suboxone, which
Yes.
are contraindicated together.
No, they're not contraindicated. No, I've listened.
Relatively contraindicated.
Right, but in the old days, things were so extreme in terms of over-medicating with benzodiazepines.
Still are.
Well, it's getting...
I know you won't do that, but it's still your psychiatrist.
Oh, my
friend
God.
might. Yeah.
Oh, no, I had somebody that went in that was on Suboxone and given 61 milligrams, 1 milligram Suboxones because they were having anxiety. That's the kind of thing. Ugh. But yeah, bipolar patients, so he hasn't gone off the deep end. I don't think he's bipolar. He got the SSRI. So. But anyway, there tends to be overreaction, adherence to a new principle or a new medication. And when things
Shake
stabilize,
out, yeah.
Right now, it's... How do you deal with? I have a 72-year-old was on 300 milligrams of OxyContin a day, and he's tapered down to 120. He does have severe arthritis and pain, and he was referred to me to start Suboxone for the pain, buprenorphine.
I'm okay with that.
Okay, good.
Not super happy with it, but I'm okay with it.
Well, but for listeners, Suboxone is sort of the new answer to methadone for people. It's medicated assisted treatment for opiate addicts, and the issue is. The people that are like Drew that are more abstinence based see Suboxone as just another opiate, it's just another addiction.
Well, as methadone was.
Right, but Suboxone, from my standpoint,
It's better.
It's
better than
non-euphoric, and
so that you don't get high from it.
Don't get high from it. Now, I've talked to Bob. I've discussed this with 50 of my Suboxone patients, and they said this to Bob, Drew.
What?
That's a middle finger.
Yes, to F off. No, so it
Drew,
is an
your
opiate,
argument
but-
is you're just giving them another drug. Question mark.
It's not just giving another drug. It's just their disease is still quite active. And as this last case pointed out, now he's on benzos and he's smoking pot, but that's not a recovery.
Right.
But that's a very complicated case. And,
Yeah.
and I'll grant you.
He's going to meetings,
And he
and
could die.
he's-
I would not send that kid to meetings, though. I would just say go to therapy, go to cognitive behavioral therapy and stuff like that.
You think that's
He's-
more effective than meetings?
Well,
Well,
for this guy, for this kid.
Well, anyway, it's
But it's all debatable. It's very complicated.
Yeah, he's doing a lot better than he was. So,
Yeah, I'm sure. I'm sure.
but I look at it as patients. I start out with abstinence only. I'll do the clonidine detox,
Right, which
and then try-
but I'm in no way attacking Bruce. I'm attacking the general sort of
Right.
winds that are blowing.
Exactly.
And Bruce applies it very rationally, very appropriately, more than anybody I know that prescribes this stuff. So,
And I really am. Every patient that I do start on a medication like that, I worry about and
Allison, how's this podcast going so far?
I think it's going great.
Okay.
So what I want to say though is now
We fight about whatever the nuances of treatment
Yeah.
of a complex psychiatric
yeah,
case.
that's true. So, but in general, I mean, opiate addiction was one of the top 3 election issues, I think. And in some states, it's epidemic far worse than HIV ever was or any other infectious disease that actually took lives.
Yeah.
Well, HIV is a horrible thing. So, but anyway, the Suboxone epidemic, they're on the other side, supporting what Drew says, it's seen as a panacea, and it's like the old...
we're hiring we're training armies of people who know nothing about
Right.
addiction to treat drug addicts, and that's not going to go well. It's not going to go well.
No. So you want to see an extremely qualified individual physician that doesn't have a financial incentive. I think that's the problem.
Yeah,
is and even Obama got up this spring at a huge national addiction conference and said there was a limit to 30 patients that you could have in your practice on this medication. Then it went to 100. Then Obama said we needed to go to 275. And then they're going to let physicians, assistants, nurse practitioners. So
my God.
I know people listening to this, there's someone that has a loved one that has an opiate problem. And I think what Drew says is correct. It's doesn't cure opiate addiction.
Right.
And
It makes you chronically ill.
Right.
So, what's the matter, Allison? What's the
No,
matter?
that was actually just me breathing. For listeners who don't know, I'm very pregnant and
Breathing is not
yeah.
easy.
My
Requires-
husband looks over all the time because it sounds like I'm doing a heavy sigh.
breathing for
I'm
two.
Like, I'm just breathing.
You're breathing for
I'm just
two.
trying to breathe. So I have a quiz.
With a
Oh,
giant
no.
thing under your diaphragm.
Yeah.
Breathing for 2. How
I,
unfair was God on that one? Bruce,
I
your
feel like my
religious thing.
stomach is in my throat.
Yeah, well, it
quiz.
is. It makes
I
you
don't
what
know
it
where
is.
my bladder is, but it's squished under something.
Well, you're
Intelligent design my foot.
you
What's intelligent about this?
you have to use just the way we're so creative and using our minds here as evidence of a higher power. Oh, so
But
no
you
quizzes.
do believe in
Have you-
evolution.
Have you seen
yes?
these unified theories of unifying string theories and where the strings are
don't
coming
understand.
from and stuff?
I don't understand
it's
that.
good. I'm going to send you some podcasts.
Peter, was it Green? Who's the guy that's written some popular?
Okay. Anyway, give us a question.
Okay, so I have a quiz. Here's
I gotta
some
go pretty
paper.
quick here.
Okay,
You
we'll
know
do the
I
quiz,
hate
then we'll
Drew
let you go.
quizzes me on the air
And then
suddenly.
Bruce will stay.
I'm gonna
He doesn't
stay.
like quiz. It makes him nervous.
Yeah, I mean-
Oh, here we go.
Okay, so the quiz is
Sorry,
designed.
protect my
Yeah, protecting it. The quiz is designed to figure out whether Bruce knows Drew better or Drew knows Bruce better.
Okay, all right.
Okay, so I was going to ask you, like, Bruce, what is Drew's favorite surgical procedure and vice versa? However, as an internal medicine specialist, you don't do a lot of surgeries, right?
None.
Okay, so I'm
But
gonna
I
change...
have a favorite procedure.
Oh, you do?
Yeah.
Okay. All right,
He
we'll
might
do that.
get it.
Okay, so you each are writing down what you think the other one's favorite surgical procedure is, and then you're writing down what your favorite
Okay,
is.
okay.
What, mine also?
Yeah, because he's going to guess yours. Drew's going to guess yours. And let me know when you have your answer. Jeff, I forget every time. Do I do the question and then we do the answer? Yes, right? Or do we do... Okay.
Done.
All right. Waiting for Bruce.
Okay. And
I'm just guessing on
Okay.
Bruce's wild guess.
Okay. Drew, what do you think Bruce's is?
Portacable shunt.
though, are you talking about something I do?
Something you like doing or were a part of or did you remember from medical school or whatever?
Okay. What is the actual answer? What's your favorite surgical procedure, Bruce?
Incising and draining an abscess.
Oh, I was
Oh
gonna,
my
I was going to
gosh.
say that. I actually
Really?
was going to say I figured you'd do a lot
That'd
of
be
that.
one of
in
my
the ER.
least
He
favorite
has to do that
ones.
in the ER all the time. Look, because there are websites dedicated to that.
I'm not a fan of
Yeah.
that.
Oh, there's an Instagram account.
Yeah.
No,
Okay.
please no.
Damn,
She's
Okay.
in Rancho
Okay, what's-
Cucamonga, that lady.
Bruce, what do you think Drew's favorite is?
I put the same thing, popping an abscess.
And
Draining
what
an
is the
abscess.
Robotic
truth?
radical prostatectomy.
Oh, well,
Because I was subjected to that and I thought it was a pretty cool procedure.
this is something you don't do. I know that.
No, but it was my favorite procedure.
Oh, okay. I thought you meant things we do.
Okay.
Okay.
All right, go
The next
next.
question is almost the opposite. What is your least... Someone put this into medicalese for me. What is your least favorite body system?
Body, like a healthy body system? Like
Like-
what are you not interested in?
Yeah, yes. What are you
Oh.
not interested in?
I'll tell you that right now. What I do in the ER when I'm not interested in. Hint.
Okay. And yours would be,
Oh, his?
yeah, mine and
You
yours.
each have to do... Yeah,
Same.
exactly.
I'm gonna do the same for you.
Okay, Bruce, what do you think Drew's least favorite is?
Pelvic. Doing pelvic exams.
No. What's your least favorite
System.
So genital-urinary system, GU system,
Yeah,
or
that-
GYN
Yeah,
system?
GYN system.
I know GI.
Oh.
I'm not very interested.
Vomiting
in GI.
blood.
It's just a tube. It's just a tube that has these these brush borders that do interesting things.
Yeah.
I mean, I would sort of leave the pancreas and liver out of it. They're more interesting, but GI is like,
Liver's fascinating.
yeah, it's
Okay.
separate. And I put the same thing for him
You think that he is
because
not
he
interested
has to
in the
get
GI
vomit
tract?
and poo on him all the time, and so
I'm still. No, I just put pelvic because I was thinking of what I do,
put the
what
same
system
thing.
I do. I hate doing pelvics
I
in
kind
the
of
ER.
like the
It's like-
pelvic stuff. I like it.
Why do you hate it?
Well, because let's see, the last 3 I did were vaginal foreign bodies. The last one I couldn't find, is I called the gynecologist last week. He comes down, he goes, "Well, there's no foreign body. You're right, but she has a rip-roaring cervicitis. Did you notice that?" And I was like,
What were the foreign bodies? Can you say?
The vibrators and tampons.
tampons
I
and
thought you
condoms.
can't push them too far.
Condoms, yeah. They go up in the
Oh, yeah.
corner. There's
Oh, the cul-de-sac.
The fornix. Is that called the fornix?
Yeah, I had a long metal forceps,
Yeah.
and I
Yeah.
got the condom, but that was really because they shrink up into nothing, and
they
they're
get
way back
smashed
there.
in there. Yeah.
Oh,
So they're beyond where someone can reach. I didn't realize
Oh,
it
yeah.
can really go.
Oh,
well,
no,
and
it
you know,
could
and
get in a
if you-
corner.
a 300-pound, 5-foot-tall individual when you're doing a pelvic. I had one where the nurse was standing behind me. I knew she was just because I had two speculum in, one sideways and one. Yeah. So anyway,
Wow.
Yeah.
Okay. This one's a little more pedestrian. Bruce, do you know what Drew's middle name is? And Drew, do you know what Bruce's middle name is?
No.
David.
Well, you got to write your answers
Well,
down.
Drew David.
Okay. Or you could just tell me.
Yeah, that's easy enough.
Which
He
is it?
said no.
Which is it?
It's Drew, David Drew, right?
He's right.
Okay, so Bruce gets a point.
Yes.
Oh, we're getting
Finally, somebody
scored?
wins.
Yeah.
Oh, now
Now,
we're
I don't know.
you don't know what
No.
Bruce's is. Do you want to even take a guess?
Watson.
Is it Watson?
Sigurd. It's weird.
Sigurd?
It's in Norway, where my mother's family, in the Viking
unfair.
culture, it's a manly
Positively
name.
unfair.
It's a manly name in the Viking culture, in the Norwegian.
All
I'm
right.
busy watching Game of Thrones right now.
One more question. Now, I was going to ask where'd you go to medical school? Except you already
just
told
said
us.
it,
Yeah,
yeah.
so I'm going to change that to, do you know where each other did your residency?
How about college?
Well, okay.
Yeah.
Well, don't we know that
Because
then?
residency tends to be the same schools that you.
Oh, it does? Okay.
Yeah.
Yeah.
All right. Do you know
College.
where Drew went to college, Bruce? And Drew, do you know where Bruce went to college?
I did.
You chose an answer you don't know?
No,
I'm winning this one. I can't believe I'm beating Drew.
Yeah, I did know, but I can't remember now. You told me once.
You went to Amherst.
Yes.
That is
he's
correct. He gets another point.
Right. And you were not in California, right?
Nope.
Yeah.
It was in Michigan.
It was a small school that I didn't know, like
It was
Saint
a
something or
lunatic
something.
fringe of Christians.
Yeah, it was Saint-
Yes.
did I-
Andrews University.
Andrews, yeah.
And it's a great school, and I'm not anti-Christian by saying lunatic fringe, but
Okay. All right. So, Bruce, you win.
Yeah.
You know Drew
Well done.
better than Drew
Well
knows
done.
you.
yeah. Well,
Wonderful.
Amherst. I mean, I hear I went to
Well, he
Andrews.
mentions it all the time.
It's
She went
forgettable.
to Pomona. She's not impressed by anything.
No, I'm impressed by
But Alice
Amherst.
Rose is still our best friend.
Yes.
Our new best friend.
Excellent.
That's right.
You are the second brightest person at the table.
She is the brightest person. I'm going to do this for
No,
her.
I
I'm
don't think
third.
so. No. Well, no. So I'm so fascinated. Okay, let me figure. It's 11:25. Should we let you go, Drew?
Yeah, I got to go. I'm sorry.
Okay,
to say. Yeah,
thank you so
for
much.
paying attention to that. I appreciate it.
Well,
I'll
tell
see
some
you. I'll
secrets.
see you this weekend. Yeah, we're going to do our
The 11th, I think.
okay weekend after that. Good to see you.
Good to see you,
really,
too.
And I will leave you guys to talk shit about me.
We should wait till he leaves, though, to talk shit about him. Thank
Yeah.
you. Bye.
All right. You're waiting for the door to close? You don't
I
think
am.
I'm actually going to say anything? that-
No. Okay. So we have listener questions. We have just mere everyone, but we have what I'm curious about, which is how does for you, I don't think I did not know that you were religious. How does that fit with the medicine stuff for you?
Right. Well, I don't know that I'm that religious. I really don't. Church activity's not a part of that. But I think believing I'm Christian. I believe in Christ. And as far as the practice of medicine, I don't sit and pray with patients in the emergency department. Probably have a bad attitude, and I should go to some sort of formalized church, something to improve my my attitude there. But I think in recovery, there's a lot of similarity, the 12 steps and Christianity or other religions in terms of the higher power,
Right.
and also emphasizing with patients that the higher power is just looking at control outside of yourself, where you were not in control of what you were doing, and that control has to become the group. But it's been a real strong support for me in what I do, working with patients in recovery, especially in recovery and medicine, being Christian, I think, for me, without ever mentioning, if someone is, I have patients that are Muslim, I have patients that are atheist, patients that are Jewish, never mentioning anything about the Christian faith unless someone's interested in talking about that. But it really has been a supportive thing for me.
I know I was surprised to find out that Drew himself has never had any addiction issues, given that that's something that he specializes in. Have you ever had your own addiction issues?
No, but I'm super codependent. That's what Drew says to me. I was complaining about.
Well, Drew is too.
Well, but he's got better boundaries, and he's been through more therapy than I have.
Uh-huh.
And so what he told me at one point, he goes, well, after a certain age, therapy really is ineffective. I just love the way he says stuff to me. So it's like, well, what are you saying? It's like 15 minutes later, wait a second. What was he saying there? So, no, but, I got in the field. I had a significant other ages ago that was alcoholic, and I didn't know it, and called me a year after we split up and said, and started, I'm doing the 4th step and I'm making amends, and I want to talk to you about, our relationship. So that, and I just tending to be, codependency is sort of a psych trash term. I think it's become something you hear on TV a little too much, but people in medicine, nurses, doctors, caregivers, tend to be better at taking care of other people's issues, and it takes away the focus on their own issues. So the more you do, the more time you spend, the less healthy you are in terms of nurturing your own relationships, your physical needs, exercising, and that type of person gets in relationships with people that have major issues, one of them being substance abuse. And so I tended to, be very good at, I'm jumping all in with patients and patient care and not really focusing on my own things. So that's been my addiction. It's considered a co-addiction. So
Right.
I went through training in the mid-'80s, and I remember we had to spend a month in this training, at the beginning of the training, in a drug and alcohol program. I didn't have to sleep there. I had to go every day as if I was a patient. And within 48 hours, they pulled me aside. They said, you better get this addressed, or you're just going to have a huge problem doing addiction medicine. And,
Your lack of boundaries.
right, lack of boundaries, and just the whole codependency thing. And emergency medicine tends to limit that a great deal, because you go, and it'll limit, for me, ADHD, it limited your focus, you address the issue, and that's the end of it. So.
Right. Do you take it home with you in your thoughts?
Oh, absolutely, yeah.
Would it be better if you didn't, or is that part of it?
Well, I think I'm better than I was, but still, occasionally you have a patient, well, here's my phone number if there's an issue when I'm not on call. Anymore, the iPhone, this is what's used when I am on call, so it's not, it's not like it used to be giving someone your home phone.
Right.
But just issues like that, and it's like, well, the next person can't do what I can do, so I the next guy on call is not who I want them, not because they're not adequate, but they don't know this. You have to, say, this is when I'm here, this is when I'm not here, things like that.
Right.
Yeah,
right.
so.
I'm going to ask this question. Then we're going to take some questions from listeners. The codependency stuff, do you feel like that came from somewhere in your childhood?
Interesting. Yeah, I think it came from, I grew up in a family that was basically very conservative Christian. And I think, the teetotaling, it's almost the equivalent of an alcoholic family in a way, the family I grew up in terms of it's the opposite. And I think that's what happens with a lot of people in Mormon families and certain very extremely conservative Christian families and other religions that tend towards extreme beliefs. And I think it can create the same sort of issues that an alcoholic family can create, which is where you get some of these type of personality type things.
In what way? Like, in what way do you feel like the religious extremism creates that?
Well, I mean, they've done studies where they have the risk of alcoholism in dependence of individuals that have a teetotaling family where alcohol is made to be the demon,
Forbidden.
the devil, and
Right.
whereas healthy, drinking once in a while because we model certain behaviors. And I think in families where there's an extreme prohibition against something and very rules oriented, I think it creates sometimes inadequacy in taking care of yourself and addressing
Right.
your own issues.
What denomination did you grow up in?
Seventh-day Adventist.
And do you still consider yourself that?
No, but I still consider myself Christian.
Right.
That system. I went to Loma Linda Medical School and Andrews University. I think it's a fantastic educational system, and I don't think what I'm saying is reflective of that religion. A lot of people see it as a cult, but it's not. They're just basically led in the area of vegetarianism and not drinking coffee and alcohol and tobacco. And when I was growing up back in the 60s, that was seen as really extreme, some of their booths. Now studies have been done, and there are longevity studies that show that lifestyle really, it's similar to some of the other lifestyles worldwide that lead to great longevity.
And do you drink coffee and tea?
I drink way too much coffee. I'm not much for alcohol. I mean, I'll go to I'll have one of Adam's beers or I'll have a drink. I don't care about that. But I don't smoke, and it was a real healthy environment growing up for me. So my father's Jewish, and non-practicing, so it was.
That's interesting.
Yeah, so because Adventist Seventh Day, like you don't do anything from Friday night to Saturday night, sundown.
Right.
A lot of the Old Testament, and that's an issue with some other Christian religions. The Seventh Day Adventists are too Old Testament based, and have a lot of the dietary laws and the don't do stuff on the Sabbath and stuff like that.
Mm-hmm. So for your father, that wasn't Seventh-day Adventist wasn't contradictory to.
I thought it was great. He didn't care. We'd go to church Saturday morning, and he wasn't practicing Jew anyway. So,
Right.
But it was like, hey, there's the schools. Certainly there are drug and alcohol problems everywhere, and there's all kinds of behavioral issues. But it tended to be activities. There was a lot of activity, but there was a prohibition against. So there was definitely no alcohol, tobacco. Did I have friends that were back when in the 70s going to college and medical school, they're smoking pot and stuff like that. But there were so many activities where there was no access to drugs and alcohol. Mm-hmm. Where at that time I thought, oh man, I'm missing out. You get all the stories from the frat brothers, and it's like, oh man, I go to this boring college and medical school. But I think it really, for me, I would not have done well with. I could not have done any kind of substance and gone through college and medical school. They're those people that you see they're partying and they're smoking pot, and you think, how do they do that? And I think that's one of the issues.
I don't understand it, because for me, if I smoke pot, I'm useless. I don't anymore, but when I would smoke pot, I would smoke pot and then try to read something, and like I would read the same paragraph over and over again. It was not going
anxiety.
in.
I did it once. I was like in high school, and it was like I couldn't say what I wanted to say, and then in my head, I'll never be the same again. I'm always going to be in this state,
yeah.
and then I same thing. Read something, and then read it again, and it was like, this is not fun. If this is fun, take me. Get me out of here. So
Right.
But today, one of the issues now with medical marijuana and now recreational is, and I know I hear Drew rant about this. It's just the percentage of THC is so high in this stuff, and it is just a super mood altering substance. Mm-hmm. If someone has a predilection genetically to addictions, it really the increasing the exposure with all these people trying it, you're going to have a much higher level of addiction occur. And I think just looking at schizophrenia, I was just reading an article on schizophrenia and how cannabis is one of the things that's noted to exacerbate and make more difficult treating schizophrenia. And then I think they did a study in England where they felt that if someone had the genetics for it, they're more likely they would develop it. So
Right. Let's take some questions from listeners.
Without Drew here?
I know. Well, I'll make them easy. Don't worry. First, though, I just want to say, you guys, if you're going to buy something on Amazon, which you are, because they have everything, click through the banner on my website, AllisonRosen.com. Doesn't cost you anything extra. It helps out the show. Great place to do all of your holiday shopping. Thank you so much for your Amazon support. Also, my show is on Patreon. Patreon is sort of like Kickstarter, but you can support an artist or a podcast on an ongoing basis. There's different reward levels. You can get extra bonus episodes every month, exclusive live stream. There's a level where you get fan club merchandise in the mail, all sorts of fun stuff. I'm really enjoying being on Patreon. It's patreon.com/AllisonRosen. Okay.
as they send them in. They're wondering how you have been. So thanks so much for answering these questions from our fans.
Okay, Breezy Matt would like to know, do doctors think things will get better or worse regarding the Affordable Care Act under the new administration?
Better.
Really?
Well, I don't. You know what? I don't speak for any medical organization, but I think one of the concerns was the increasing premiums for individuals that are paying for their health care. And in some states, it was, doubling, tripling. So the concern doctors have that I've heard two things, pre-existing medical disorders. That's a huge thing. There was the question was, is that going to go away? And I think that there's no way they're going to change. If you have a pre-existing medical disorder, my sister has a brain tumor. She's had it. It's been sort of dormant, but that's on her record. I mean, they just take one look at one diagnosis, glioblastoma, and you're done in the old days. So that, and then covering individuals under their parents' coverage until the age of 26. Those are two of the things. So I think the issue is it going to be a mean-spirited cutting off of Obamacare and taking away coverage from people?
Right.
But there were 15,000 pages of Obamacare doctrine that was very difficult to sort out. And I think when a lot of this stuff happened, there wasn't enough analysis of how it would change the system. But there have been definitely, and I think it's representative of what I see as a democratic society, is we need to take the best of Obamacare and look at how it's created some of the problems it's created and come out with some sort of compromise. That's what I hear most doctors say.
Do you think Obamacare was an improvement over what we had before?
I think it addressed some of the issues of the underinsured population and again, pre-existing disorders covering individuals till they're 26. But it was, it assumed that people that were healthy would be paying towards the care of individuals that are not. And I know in the state of California, I mean, there's all kinds there are people that are included in Medi-Cal, Medicaid, and that a lot of this, I think, is mandated by Obamacare. And there's certain groups, I won't go into any detail, but it's just giving away care to individuals that probably shouldn't be in that covered California category. So I think it's one of those things. Sometimes there's an overreaction to the way things are. And again, I don't like to see medicine as a Democratic or Republican issue, but doing what's best for the patient. I think there were definitely aspects of Obamacare that should be kept, but I don't think it's sustainable. I don't think it's a sustainable program unless you go to a single payer and eventually the government. And doctors are afraid it's going to become like the VA is now. I mean, you got the Veterans Administration, which is a government designed and a system of provision of medical care to veterans whom we supposedly value, and it's been a disaster.
Right.
And so I think if you have the government manage it, which is I think what Clinton wanted to do, is have a single payer system. I think you have to be really careful with that. But on the other hand, it was almost embarrassing the way things were in medicine, precluding care to people because of financial reasons.
Right. So. I think part of the reason my dad was excited to retire was that he felt like the insurance companies were ruining medicine. And I mean, like, he has a check for 16 cents on his wall, and he felt like, as kind of showing what happened to it. And I think he felt like all of a sudden doctors weren't the ones making the call anymore. A doctor couldn't say, I'm concerned about this patient, I want to admit them to the hospital. All of a sudden it was the insurance company, or it was some non-doctor who was making the decisions. Do you find that? Well, I guess in the ER it's a little bit different, but
you do what you need to do in emergency medicine. I've not been in a system. The system I'm in, I'm not supposed to say, but in certain large medical groups in Southern California, the provision of cares, you're not asked for the approval to get a certain test. I mean, sometimes for an MRI, but there's still that concern that if we go away from Obamacare, we're going to go back to more of this second guessing by bureaucrats as to whether someone should get certain care. And I think there was less of that. But on the other hand, the system, it wasn't really working financially. Right. And unless you go to a totally, basically socialist system, which is, I think, where maybe some people want to go, I just don't know if that's, I mean, ideally, sure, there wouldn't be money everybody would have transportation, but I just don't see that happening in this world. But on the other hand, I do work in a system I think is a very good system and that provides care without questioning, a lot of the financial issues. But people come in and like in addiction medicine, hey, I want to get inpatient care. Well, do you really need inpatient care? Do you need inpatient detox? Do you need residential treatment for a month when it's not going to really make any difference? So some people, they'll say, well, that's, it's a financial incentive you have. No, it's their indications for certain procedures and for certain levels of care for addictions or psychiatry or something like that. And I think part of the problem with the media and social media is you can make anyone look bad or anyone look good at times, just in the moment. And it becomes very difficult practicing when, the first thing people do when they don't get what they want, they get on social media or they contact the press. So part of it, I think we've refined indications for certain medical issues now. They may appear stringent, but they're much more appropriate in terms of, there's not unlimited resources. And sometimes it's more appropriate to tell someone, hey, this is what you need and this is what you don't need. But today people don't want to hear it. It's sort of like Burger King. It's like they come in and, hey, this is what I want. I mean, I have people come to the ER. It's like, hey, I'm not leaving till I get a CT scan, an MRI, these tests, see this specialist. Well, it's Saturday night and the dermatologist isn't here tonight. Well, I want to know what this thing is on my arm. I want to know before I leave. I mean, that may be unusual, but that's the direction. When Drew was talking about my significant other, I mean, just when when someone's in triage, the people that come in, and they'll tell you what the emergency is, and they'll say, I've been waiting an hour, I've been waiting 2 hours. One of the things with Obamacare, you have a huge influx of people using emergency rooms that maybe, shouldn't be there, and
because it's not an emergency.
It's not an emergency, and the laws of bureaucracy. The medical center I'm at, we have an urgent care that's doors down. And if somebody comes in with a non-emergency problem and there's a 6-hour wait and there's no wait in the urgent care, not allowed to tell them. You can't, because it could be perceived as an EMTALA violation of a denial of care. And I'm sure someone will contact you or say, I'm full of S, but that's basically, there is so much. And where did that come from? It came from somebody being diverted with a medical problem in an ambulance from the nearest hospital because they didn't have insurance or they had Medicaid or Medi-Cal or whatever. There's a reason for some of these laws being there, but there's been an overcorrection, I think. Do
you not swear, or are you just trying to be respectful of me? Because you can say the S word.
Oh, yeah, I don't know. I don't.
Look at you.
No. Are you kidding me? My kids would go, he'll swear if somebody cuts in front of him on the road.
Okay. Fuck. What was I going to say? I was going to say something about...
How dare you?
I know. I'm sorry, right in your face. About urgent care or about the emergency room.
Utilization.
Oh, no. Maybe I know what I was going to say. On drug commercials, they're always like, ask your doctor about blah, blah, blah. And I'm thinking, who has that line? Who has that direct access to their doctor like that? The only time in my life I've ever had anything like that was I went through IVF, and with my fertility doctor, I had her email on her cell phone so I could text her a question. But in general, I find that there is this message that we're fed in culture of like, you should be an informed consumer this is probably going to make you angry. Like you should be, I mean, you probably dislike this, but like you should be an informed consumer when it comes to your medical care. And like you should really be driving the bus. And I just find that like I've never been able, I don't even know how I would have that with my doctor. And I've never even been able to do that. Like I'm, with my OB right now, I have a doula because it's Los Angeles and you have to. And my doula was like, find out what her C-section rates are, like her percentage of C-sections, and find out, telling me all these questions to ask her. And I don't feel comfortable asking those questions because I feel like I'm auditing her.
What's your dad saying?
I actually didn't ask him about that. Yeah. He doesn't even know I have a doula yet.
Well, let's say I've had a relationship with Kaiser system in the past, and in that system, you're accountable to your patients. There's email, and there's no difficulty getting hold. There was no difficulty getting hold of me. And though, so when I say anything, I expect what the onslaught of critique is going to be for, say, somebody like Kaiser. But a system like that, felt that they were super concerned about patients having immediate access to their doctor and being educated and asking questions and getting answers.
And how did you feel about that? Was that a good thing, or was that?
No, I think it's, I liked it. What I don't like is I've had patients come in, like I was in the emergency room, I had a guy that had an ophthalmic migraine and he was losing vision intermittently or something. And this was quite a while ago, so I may get the details wrong. But basically, the guy, his sister was there on Google reading it and telling me what she wanted. Okay, I want a CAT scan today, and I read this, and I want him to see an ophthalmologist today, and I want to know what the risks of an MRI versus a CT angiogram and this and that. And I'm like, it was just brutal. And so there's that side of it. And then patients that come in with a laundry list of articles they've read on something, and then you get quizzes. I think it's sort of like it should be a team approach.
Right.
And I like an educated patient that says, hey, doc, what about, I've been reading about this, and what do you think about this? And hey, many times I'll say, I don't know. I mean, the best thing I can ever say when I don't know is, I don't know about that. I don't know about that treatment. And it's the nature of a partnership versus a control. Like, you're my doc, and I've had patients say, you're the effing doctor, and you're going to do, and I've had this, you're going to do what I tell you to do, because that's the way the system works now, is you're the doctor, but you work for me.
Right, that seems backwards.
Yeah, and it's...
Because one person has so much more knowledge, and it's not the patient.
Yeah, well, but access to the internet, there's a huge amount of knowledge, and it's like
right.
Drew said, how does this one molecule get from here to this gland or organ? There's a lot of things. There's a lot we don't know, and there are a lot of anecdotal things on the internet. I mean, the problem with the internet is opinions and then anecdotal stories or studies that are based on a significant N number where you don't have enough people in the study where the result makes a difference. So.
Right. In general, when patients come in who full of knowledge, do you find that they are usually right or are usually wrong? Could you make a generality about that?
I think they usually come in with a lot of right information, but using it to make decisions is totally out of their realm, and they have pre-existing conclusions as to what that information should lead me to do. Mm-hmm. And that's what concerns me, where then it becomes an argument or not what's best for you, but, well, I read this and I want these things done, and that, you know what I'm saying, where they've decided, rather than saying, gee, how would this fit into what's best for my treatment plan?
I think I've heard, I don't want to put words in his mouth, but I believe I've heard Drew say you go to a doctor for that doctor's judgment, not for their knowledge.
No, excellent. Yeah. Yeah, you're assuming the knowledge is there, and but it's the decision-making process and tailoring. There can be, and it again, the same professor that this one guy was like, just do something. He's a brilliant gastroenterologist. He'd say, do something. And I remember he used to tell me, if you call a patient a crock, check your own porcelain level. And, and things that really bore them. It's just like going to an AA meeting. You hear these little phrases and sayings, and you go, what kind of, and they have a lot of knowledge, wisdom behind them. But, what was your original question for it? There was a third thing that he used to tell us that was relevant to
judgment versus knowledge. Was
right.
What you're saying.
Right. Bringing the information. I was thinking of another patient I had that came in, and she gave me all these reasons. This was an alcoholic patient, and all the reasons why AA doesn't work. And I read this article, and only 5% success rate. How can you recommend something like this? Do you provide CBT, cognitive behavioral therapy here? I want a complete outline of your therapist, what they do, where they were trained.
No, I'm already irritated by her.
Right. And it was a college professor. So, and which doesn't mean it, but I mean, it was a highly educated individual, but it came back to, I felt intimidated, and it was not, gee, it took up time for her to tell me all the things she wanted, where I didn't have as much time to evaluate, ask her the questions that needed to be asked. It was like, well, I know my diagnosis, and this is what I think I need, and do you guys provide it? So if we put does the patient really want to become the doctor? I don't know. Sometimes they do. And, it's just like CAT scans in the ER. It's one CAT scan, and there are a variety of statistics, but something like you have a 1 in 20,000 chance of certain types of brain cancer. You do one CAT scan, it goes down to 1 in 2,000. There's studies like that. So there's a lot of radiation, and now this pendulum swung so far the other way. If I order a CAT scan of a head, what pops up on the computer is, did I tell the patient about the radiation risk, and do they really need this study, which is good. But, I have patients come in and, well, I just feel better if my 2-year-old had a CAT scan after they hit their head. And it's like, or I say, wow, do you want, they take that radiation with them the rest of their lives, and it's like, well, my aunt who's a nurse told me don't leave there without a CAT scanner.
Okay, let's do Just Me or Everyone. This is where people write in with things they think or do, like idiosyncrasies, and then we weigh in about whether we also do these things.
Sometimes I ponder on something I have thought or done. Is it just me or everyone?
Okay, Jay Inslee says, when I dream, I can never hear sound. I see people talk, but I hear nothing, even when I have nightmares. Not me. There's all sorts of talking in my dreams.
Yeah. Yeah. What about color versus black and white?
I have dreams in color too, and I remember when I heard someone raise that point a long time ago, and I was like, "What? Some people don't even dream in color." My dreams are very much like real life, but absurdist.
My dreams, strangely, are in 4:3 aspect ratio and not 16:9.
Right.
I don't know what that's about.
My dreams have a real fast refresh rate. So it looks a little jerky sometimes. I'm hoping to catch up with it.
How about writing your dreams down? I've always wanted to do that and never done it.
I have done it.
Do a journal.
I've done it not in the middle of the night, but in early. Like if I have a particularly disturbing dream that I feel like there's something there, sometimes first thing I'll sit down at my computer and just type it all out just to try to get to like what was that about,
Mm-hmm.
But I don't regularly do it because it's kind of a pain.
Mm-hmm. Yeah.
Bruised by Dawn says, hate walking into a necessary meeting at a customer site only to find out everyone there has been or is sick. # not cool. Well, you're around sick people all the time.
Yeah. My parents are like 94 and they're both got this cold. Well, they could die from pneumonia from it. But I tell them there's some study that showed if you get a minor viral infection 5 times a year or something, you have much less of a chance of having a severe illness. So, boy, talking about stuff as a doctor, it's like, well, somebody's going to say, well, that's a bunch of BS every time I say something. It's always so. Anyway, I don't like vomiting kids because in the ER I don't like being vomited on. I must say that. So if I go to a meeting of patients and I get vomited on, I'm certainly not excited about that.
Is that because it's gross, or you don't like it because of what could be in the vomit?
Yeah, it's interesting. Even being in the room with someone vomiting, some of the viruses are so what should I say?
Airborne?
Oh, they're very much airborne, but you need very few. I think it's like the norovirus. Some of these ship viruses, like 12 viral particles that can infect you. It's like that. That's just shocking. I mean, it's just such a small amount, and yeah, they are aerosolized, and it certainly. I don't like stomach flu, that kind of virus. There's no immunity. You can get it and get it 2 days later. Basically,
right.
It's a weird thing. So.
Does the flu vaccine not protect you from any of that?
Well, there's some studies I think that show that people that get the flu vaccine have a slightly lower rate of other, like there are over 100 viruses that can cause cold symptoms. But I would tell everybody out there, get the flu vaccine. I had influenza in 1996. I almost died. And there's another guy my age, a doctor. I was in Redlands. This guy was in Riverside, and he got it. We both got bacterial pneumonia like a week and a half later, and he died.
Jeez.
Yeah, and I was like listening to myself. I sounded, crackling pneumonia. I was on antibiotics, and it was just so. That's the danger with some viruses. Influenza knocks the immune system down, so you start to recover from it, but your immune system is inhibited, and then you get the bacterial pneumonia, and it kills you. So,
is influenza? Because I feel like people toss the word flu around.
No
quite
relationship to it. The flu is a bad cold, basically.
Yeah,
but influenza is a severe infection, which when I got it, a lot of people get it. The first thing you're feeling fine, and then within a couple hours you have a very high fever. It feels like somebody's got a clamp around your bones. This extraordinary bone pain, weakness, and then frequently get the respiratory stuff, cough,
right?
And certain strains, certain years, like the 1918 epidemics, young healthy people died more commonly than other individuals with really strong immune systems, because you get this in your lungs and you get this huge immune response to it, and fluids would be released from the white cells, and they'd have death within a couple days because of their immune system being so strong. So it's a weird virus that does different things, different years, and different characteristics. But get the flu vaccine if you're
Well, now
out
I'm
there.
scared.
Well,
Okay.
you've gotten the flu vaccine, right? Being pregnant,
I
they just did
know.
a study.
I haven't gotten it. I know I'm supposed to. I don't like shots that hurt.
Oh, it's not that bad. Plus, in pregnant, I just read this study. No increase in autism. There have been concerns about.
I'm very pro-vaccine.
Okay.
I'm just anti me getting shots.
Yeah.
But I'm very pro-vaccine.
The last 5 or 6 of them that I got, I can genuinely say I did not feel it at all.
Really?
The
And not
people-
even the next day?
No. And they say, which arm do you want it in? And I think, I sleep on this one. or I
His
use this one
arm.
for mouth.
That's what I say.
Somebody else's arm. Put it in your arm.
Flu vaccine's not bad. You get the one for pertussis, and sometimes the next day it's like you got punched in the
Oh, really?
or hit in the arm by a truck. But it's
Oh, wait,
still,
no,
it's
not
bad.
pertussis. There's some booster I'm supposed to get at 33 weeks. It's the initials. It's the one that everyone gets as a kid. It's like diphtheria.
Yeah, that's
dip
got
tit.
pertussis.
That's pertussis.
Yeah.
So that one hurts?
No, that's not that
I think
bad.
you just
The next
said it.
day
I think you
hurts.
just said it does.
No, it doesn't hurt when you get it. It's the next day you feel. No, but none of them are that bad. I mean,
I guess. When I got the pertussis as a child, I actually had a whole reaction in my arm and got it necrotized. So I'm worried about that potentially happening again, except that my sister had the same reaction as a child.
and they said she wasn't allergic, she did too. But
Yeah,
you
it's
don't have an
weird.
egg allergy. Or,
No, and then she, when she was pregnant, she got it and didn't have that reaction. So I don't know if it was just something in the medicine that was used back then. I don't know what it was. Anyway, not looking forward to it.
So going to a meeting, what do you worry when you go in a meeting?
And everyone's sick.
Oh, no.
only as a pregnant person who has not gotten the flu vaccine. But
Oh, yeah.
normally, no.
Yeah. What about, do you wear a mask? You ever wear a mask when you go out in public?
I never have, but my doctor did say if you're not going to get the vaccine, you might want to do that.
Yeah.
Does that? I mean, are the particles really that big that a
Very
mask?
good. No, you got to get an N95. You get a mask that will. Yeah, but the thing is, if somebody coughs on you and you have that on, just
You're
from
still
a physics
screwed.
standpoint, no, you're better off. I mean, so there are situations I'm sure it would decrease, but is it going to block a virus? That the pores in those masks don't block viruses. So.
Right. But you just look cool. Okay. The Great One says, Jeff, you're going to have to tell me if we already did this one. When something really crazy happens on a television show, I check to see how much time is left in the episode. Have we done that?
No, that doesn't ring a bell.
Okay. At first, I thought, that's crazy. No. And then I realized, oh, no, I do that. Because if something crazy happens on a show, I do check to see how much time is left. Because my thought is, oh, man, is it going to be a cliffhanger? Are they going to leave us on a cliffhanger? So I do check.
Something crazy happens.
Yeah.
I check when I'm really enjoying something. I check to see.
I do that
It's
too.
like, dang, I don't want this to be over.
Yeah.
I have to go back to my horrible life.
I do that too. Even if it's not television, I'll want to see what time it is. But people always think that means you're trying to get out of there.
I thought you meant if you're doing a show and you have a horrible guest. If
Oh.
I'm boring you, you're sitting here right now going, God, I wish the show were over. This guy's so boring.
No. He means a show he's watching.
Okay.
Let's see. Dave Ross, when people post iPhone screenshots online, it stresses me out to see low battery life percentage remaining.
That one we've done.
We have done that one?
Yeah.
Okay. It doesn't stress me out.
If it does, you need an SSRI.
There's
You've
a
got
lot
an
of
anxiety
people-
disorder.
A lot of people, it seems to stress out. Talk to Dad says, in the morning, socks feel good. By the end of the day, they're unbearable. Can't wait to take them off.
Oh, yeah, absolutely.
Really?
Yeah.
That's how I feel about bras, but not so much socks.
Well, my bras.
Really? You must have some kind of 36-hour number. Adri214 says, never know what side of cling wrap is the clingy side. Always end up getting frustrated, balling it up, and using foil instead. I find cling wrap to be a very frustrating product. I didn't realize one side is clingy and one isn't, though.
I didn't either. And now
Maybe-
I'm thinking maybe that's my problem with lack
Cling
of
wrap?
cling efficacy.
Maybe,
What's
yeah.
the clingy side? The inside side?
It's the one that's not. It's the
Sticky.
other one,
There's a
clearly.
sticky side. I really didn't know that either. What about
I'm not
aluminum
sure it's
foil?
true.
There's the bright and the dull
Right.
side. Tell me the difference.
I one. I know that you're supposed to use one for something, but I don't know what. I don't use foil very much or cling wrap really. I use Ziploc bags.
Yeah, I gave up on cling wrap, so now, I use a lot of Ziploc and I use a lot of Tupperware or recycled plastic containers from things.
Right.
My father's so old school. To save money, he buys the little plastic bags with the ties.
Oh, really?
Oh, my God. It drives me crazy. Not even the ones where you fold it in. Those used to be hot. Those were cutting edge for like 40 years ago.
Fit snugly around your sandwich.
Oh, yeah. But the ones where you put those...
Right, the little ties.
Oh, my God. I'm sure those ties are eaten by some sort of animal, which
probably
has decreased their population.
Poor animal that eats twist ties.
Poor wombats.
Harry Bowles says, the term wildly is used wildly more on podcasts than in the real world. Well,
nah, come on.
Adam would say wildly all the time.
Well, you know what Drew's favorite? One of his favorites is profound.
Oh, really?
And I've taken that. I love saying that's a profound insult.
I just heard an episode of Sam Harris's podcast, and it's like, he's a smart guy. And he said he was describing someone and said that they had literally gone through hell.
That
and I
drives
thought,
me
really?
insane.
Did they see Satan? Was he there with his pitchfork? Because they literally went through hell.
I can't.
That is the perfect example of figuratively going through hell. I was very disappointed.
Yeah, it's weird. Literally, it's just used to emphasize.
I heard somebody saying irregardless. And normally I used to use that, and it's like, quit being so picky about it. But now it irritates me when someone says irregardless. And it was
because
a doctor
is it because you stopped using it?
Yes. Must be.
And lastly, Sam Vance says, just me or everyone, I see too few posts from LA where the person has on shorts or short sleeves. Why make it hotter on yourself? This is when it was super hot. He wrote that. Yeah, I'm not a fan of short sleeves or shorts on me. Other people, it's fine.
What about a guy with a short sleeve shirt and a tie on? There's something offensive about that to me.
Like
short sleeve shirt,
shoes aside.
I need to have a pen protector, or if there's a short sleeve.
It's
shirt
very
and a
Dilbert.
tie?
Yeah.
Yes. Or a shirt tucked in.
Yeah.
And shoe and sort of loafers and I don't know what kind of shoes, but tucked in shirt, short sleeve with a tie on, and buttoned when it's hot. Come on, you got the short sleeves because it's hot out, and now you got your collar buttoned.
Yeah, that looks silly.
It makes me annoyed.
Also, t-shirts and scarves. What's going on there?
It's
a whole look.
T-shirts, autoeroticism. They're covering their neck.
Well, that I hadn't considered, but now that you bring it up, perhaps. Dr. Bruce. Thank you so much for coming on the show.
So many people from the audience left when Drew left.
I know.
There's only 2 people left.
No, listen, you guys, studio audience, we need a rousing applause. They're back. They all came back.
Oh my God, they were outside smoking pot.
That's right. From an aluminum bong.
Right.
Tell everyone where they can go to find you, and I don't know if you know Drew's plugs, but if so, do. And Weekly Infusion. Okay.
And you can send stuff to me there. I have some Twitter thing, Dr. Bruce H, but I'm really bad at. I answer more of Drew's things than I do my own. So drdrew.com, drdrew.com. Weekly Infusion is our podcast. We're really refining it and getting it down to a fine, sharp edge, or whatever you say.
Scalpel edge.
Getting spastic again. So anyway, Weekly Infusion, it's free, of course. It's a weekly medical show, but we're trying to make it interesting to just anybody. And drdrew.com is the best place to get all of that stuff.
And Weekly Infusion is also on iTunes, right?
Yes,
you
it
can
is.
Search there. This podcast is on iTunes. Maybe that's where you're listening to it. If you'd like what you're hearing, subscribe. iTunes.com/Allison Rosen. And follow me on Twitter at Allison Rosen and the show's Twitter feed at ARIYNBF. Jeff, where should we go for you?
You can find me on Facebook and Twitter at Colonel Jeff Fox. And if you love Larry Miller and the Larry Miller Show, check out the new Larry Miller store, LarryMillerShow.com/store. Lots of funny T-shirts.
Again, thank you so much.
And thank
it
you
was
for
great
having
catching
us.
up.
Drew was super excited about coming here.
Oh, good. Yeah.
Me too.
All right, you guys. Thank you for listening. I love you. Goodbye.
Hey, do you know about the Allison Rosen Show?